Welcome to the Medi-Cal Rx Reinstatement webinar. Today, we will be discussing the next phase for Medi-Cal Rx for providers and pharmacies, as well as beneficiaries. The agenda today will include the phase reinstatement codes for Drug Utilization Review 88. We will also address Wave 2, which promotes the ways to submit prior authorizations through Cover My Meds. Next, we will look at the reinstatement of prior authorizations for certain drug classes, a physician-administered drugs policy update, and a navigation through our covered drug list and NDC list. We will finally review helpful context and resources at the end. Let's begin by covering the phase reinstatement. This is a timeline and roadmap for reinstatement. The phases will be data-driven and consideration from stakeholder feedback. Phases will fall in line after what's experienced in first phase. Communication will be provided for each phase. The guiding principles of our phase reinstatement will be to focus on stakeholder feedback as the fundamentals to the design and implementation of this plan. Reinstatement will be gradual and iterative with intense focus on stakeholder preparedness and performance monitoring and nimble adjustments. The purpose is to align with objectives and reduce disruption as well as to ensure safe and timely delivery of pharmacy benefits. There will be 30-day notices for each of the waves. Within Phase 1, we have 3 waves. Wave 1 encompasses the reinstatement of claim edit Drug Utilization Review Reject Code 88. Wave 2 is the promotion of Cover My Meds for prior authorization submission. And Wave 3 will reinstate prior authorization for 11 drug classes. Please note that the beneficiaries 21 years and under starting a new prescription within the 11 drug classes are excluded. For Phase 2, we will also be a 30-day no advance notice. There will be 3 cyclical waves and a reinstatement of prior authorizations for 71 drug classes for new prescriptions. In the first phase, we will focus on the reinstatement of Claim Edit Drug Utilization Review, or DUR, Reject Code 88, effective on July 22nd of 2022. Reject Code 88 will be reinstatement. DUR alerts and scenarios will be displayed in the following 2 slides. The scenarios column on the table provides information as to what triggers a DUR rejection and the reason for service code. The reject or informational message column displays if it's a hard reject or if it's an informational message only. Multiple alerts on prescriptions are visible to the pharmacist and are prioritized by therapeutic problem type according to the hierarchy, as listed in the following table. This slide provides the remaining DUR alerts and scenarios. Effective July 22, 2022, claim edits for Drug Utilization Review DUR requirements have been reinstated. Specifically, claims will reject for National Council for Prescription Drug Programs, or NCPDP, Reject Code 88, Drug Utilization Review Reject Error for DUR alerts such as drug-drug interactions, high dose, early refill, etc. DUR NCPDP field table includes the field number, field name, value that displays each DUR response, payer usage that indicates RW is a required field in the payer situation that further elaborates the requirement. Review the Medi-Cal Rx billing guidelines in the NCPDP Reject Code 88 DUR reference guide to avoid or resolve claim rejections. The link is provided on this slide for reference. Now let's talk about Wave 2, which is an overview of the Cover My Meds portal to submit prior authorizations. Navigating through Cover My Meds homepage, you can find some of these resources. You can click on support from the menus on the top to display the options for FAQs and contact page. In the bottom right corner, you can click to display the chat functionality. Let's discuss some of the benefits to submit a prior authorization through Cover My Meds. A large population of providers is using Cover My Meds. Medi-Cal Rx has partnered with Cover My Meds to continue to allow prior authorization submission through this platform. Cover My Meds allows pharmacies to initiate prior authorizations and prescribers to both initiate and submit prior authorizations. CoverMyMeds interacts with Medi-Cal Rx to provide questions and covered alternatives directly to the prescriber with the ability for real-time approvals. Additionally, CoverMyMeds integrates with several EMR systems. You can check your pharmacy system is integrated by checking on the CoverMyMeds page, Pharmacy Solutions, CoverMyMeds Electronic Prior Authorization Platform. We have linked it in this slide. Navigating to the CoverMyMeds homepage, you can view some of the resources that they provide. Providers are able to create a new account and sign in into existing ones. Whenever they receive a key from the pharmacy, they can directly enter it on the above menu to start working on the prior authorization directly. Their support menu provides links to their FAQ displays here and their contact page. We will go into more detail in the next slides. In the bottom right, you can find the pop-up chat to contact the customer service representative to receive immediate assistance. CoverMyMeds has a robust customer service team that provides assistance through various channels. Providers can utilize the chat function, email customer service directly, contact by phone, and register for webinars to learn more tips and tricks on how to submit prior authorizations. The chat feature is convenient to receive immediate assistance from the CoverMyMeds team, whether your questions is related to portal functionality or about the specifics of prior authorization submission. Prescribers can also inquire about the status of prior authorization by providing the CoverMyMeds key in the chat. If a provider is working outside of their normal business hours, they have the option of email support. To have more in-depth knowledge of the CoverMyMeds portal functionalities, providers can register for webinars that are offered on specific dates and times. They can find the registration link at the bottom of the FAQ page by clicking on Join a Webinar. For the final wave of Phase 1, let's talk about the first PA reinstatement that will be confined to a certain drug classes. Reinstatement of prior authorization will begin with these 11 drug classes, but only for beneficiaries who are starting a new drug therapy. When prescribing a drug in one of these drug classes for a patient who has not been on the drug over the last 15 months, you can check the Medi-Cal Rx covered product list. As a reminder, new prescriptions for beneficiaries 21 years of age and under for medications with the 11 drug classes are excluded. That means that new prescriptions for children and youth within these 11 drug classes will not be subject to a prior authorization reinstatement. Medi-Cal Rx will continue to look at historical claims and approve prior authorization data to allow for grandfathering and continued access for care to beneficiaries. Prospective pre-aid requests for beneficiaries currently on drug therapy and covered under the transition policy will not be accepted at this time due to the transition policy that is already in effect. There will be more guidance on proactive PAs as we assess each phase for beneficiaries. Next, we will briefly discuss the 5 prior authorization submission methods. The first preferred method is the Medi-Cal Rx Secure Provider Portal. Both pharmacies and prescribers can submit through this channel. The second preferred method is CoverMyMeds. Prescribers can complete prior authorization requests through the submission method. Some pharmacies also can initiate prior authorizations on behalf of the prescriber. Pharmacies can use NCPDP P4 transactions that are submitted directly from the pharmacy utilizing the NCPDP layout. The pharmacy can request and submit a prior authorization on behalf of the beneficiary or the provider. Providers also have the option to fax prior authorizations via postmail through USPS, UPS, FedEx, or any other courier service. For additional help with submission of prior authorizations, you can always refer to the Prior Authorization Job Aid and the Prior Authorization Submission Reminders, both linked on this slide. That concludes reinstatement updates. Now shifting gears to a policy update. Prior authorization approvals of PADs or physician-administered drugs are billed by pharmacy providers that are not intended to replace PAD coverage as a medical benefit. PADs will always remain a medical benefit even when they are also available as a pharmacy benefit on a case-by-case basis. A good rule of thumb is when a service is rendered by a physician in a medical setting, the service is billed as a medical benefit. When a service is rendered by a pharmacist in a pharmacy setting, the service is billed as a pharmacy benefit to Medi-Cal Rx. Some services that are rendered by a physician that are considered a medical benefit are chemotherapeutic agents, anti-rejection medications for organ transplants, and long-acting contraceptives. You can refer to the alert Medi-Cal Rx billing policy for physician-administered drugs for more information on PATs. We have linked it in this slide. Next, we will go through a navigation in the Medi-Cal Rx portal through our CDL and approved NDC list. We will now play a short video that contains this navigation through the Medi-Cal Rx portal.
This is a navigation in the Medi-Cal Rx provider portal to the contract drug list and the approved NDC list. In the portal, you have two ways to access forms and information, from the menu on the left or from the upper right drop-down Tools and Resources menu. You can click on either one of them. From the new left menu, you will find the covered product list. Click on it. It will display the pages and the documents containing the pertaining information. The very first link will take you to the Medi-Cal Rx contract drug list that will open in a new tab in your same browser. Here, you can utilize the find function by pressing Ctrl F on your keyboard. You can then type in the name of the drug that you're looking for. Going back to the portal and forms and information, you can see here the Medi-Cal Rx approved NDC list. This list is updated monthly, and you can see the month in the title right here. When you click on it, it will download the Excel spreadsheet. You also have to click on it to open. You can utilize the same Control M function by name, generic, or NDC. The first column, also named as product ID, is the NDC number. As a reminder, the first 5 digits of an NDC are also known as the labeler code. The second column is the medication name, strength, and presentation. The third column is the generic name. The next column indicates if a prior authorization is required, and the last column will indicate if the prior authorization requirement is in effect currently, if it will be in effect by Phase 1 Wave 3, or not in effect. The second tab available has a spreadsheet containing the NDCs under the Reinstatement Phase 1 Wave 3 that will require a prior authorization. This is the end of the navigation.
To conclude our presentation, we want to provide you with important resources and contacts on the next 3 slides. Here you will find a compilation of lists to our contract drug list and other covered products separated by drug class. We have included helpful links to efficiently navigate through the Medi-Cal Rx resources. Because the most important message we want you to take from today is that the Medi-Cal Rx team is here for you. Our pharmacy service representatives can provide you with office hours and one-on-one attention to your questions about anything related to Medi-Cal Rx. And you can email us at medicalrxeducationoutreach@magellanhealth.com. Also, our customer service center is available 24 hours a day, 7 days a week, 365 days a year to provide around-the-clock support. Thank you for attending this webinar.